Hi everyone, welcome back to my channel. In today's video, we will solve some sample questions for the CPC exam. To feel confident on the CPC exam, you have to practice as many questions as possible. So let us start with the first question. Before that, don't forget to hit the like button, share this video with your fellow coders and also subscribe to my channel CodeMed Mastery. The term that defines the relaxation phase of the heartbeat is option A, systole, option B, sinoatrial, option C, diastole, option D, septa. The correct answer is option C, diastole. During diastole, what happens is the heart muscle relaxes and allows the chambers to fill with blood. Option A, systole, refers to contraction phase where the heart pumps blood out. Next question. Anesthesia services includes the following care. Option A, preoperative, intraoperative. Option B, preoperative, intraoperative and postoperative. Option C, intraoperative and postoperative. Option D, preoperative and postoperative. The correct answer is option B, preoperative, intraoperative and postoperative. Anesthesia service typically includes preoperative, intraoperative and postoperative care. This means that the anesthesia team is involved before the surgery to prepare the patient, during the surgery to manage anesthesia and ensure the patient's safety, and after the surgery to assist with recovery. So the correct answer is option B. Next question. This is a patient with atrial fibrillation who comes to the clinic laboratory routinely for quantitative digoxin level. In the options, they have given CPT codes as well as ICD codes. So let us check the CPT codes. Check option A, first code 80305. 80305 is for drug test, presumptive, any number of drug classes, any number of devices or procedures capable of being read by direct optical observation only, includes sample validation when performed per date of service. And option B, 80306 is for drug test, presumptive, any number of drug classes, any number of devices or procedures read by instrument assisted direct optical observation. And option C, 80162 is for digoxin total. In option D also the code is 80162. So which among these three codes is correct? The correct code is 80162, which refers to quantitative digoxin level test. Therefore, we'll eliminate option A and option B. Now we have to choose between the ICD codes, that is I48.91 or I48.0. I48.91 is for unspecified atrial fibrillation. I48.0 is for paroxysmal atrial fibrillation. In the question, they have mentioned patient with atrial fibrillation. Therefore, the appropriate code will be I48.91. The correct answer will be option C. Next question. What is the medical term for inflammation of the liver? Option A, hepatomegaly. Option B, hepatitis. Option C, hepatopathy. Option D, hepatoma. The correct answer is option B, hepatitis, because itis means inflammation. The term hepatomegaly in option A refers to enlargement of the liver, hepatopathy refers to disease or disorder of the liver, and hepatoma refers to tumor of the liver. Next question. A patient presents for trimming of 10 dystrophic toenails. So we have to choose the appropriate code. Let us check the HCPCS code G0127. G0127 is for trimming of dystrophic nails, any number. For the trimming of 10 dystrophic nails, we will use the code G0127, which is in option C, because this code covers the trimming of any number of dystrophic nails. So it is reported only once. We should not multiply the code based on the number of dystrophic nails. Next question. In the ICD-10-CM, how should unspecified codes be utilized? Option A, frequently, as they are easy to use. Option B, only when the documentation doesn't provide more specific information. Option C, when the coder is unsure about the specifics of the condition. Option D, in any situation where a quick code is needed. The correct answer is option B, only when the documentation does not provide specific information. Unspecified codes in the ICD should be used when the medical documentation does not provide enough information for a more specific code. Coders should always strive to code to the highest level of specificity, and we should use unspecified codes as a last resort. Therefore, if the medical documentation does not provide enough information, we will use unspecified codes.